Welcome to the Make Space for Growth podcast. My name is Sara Vicente Barreto, and I'm your host. I'm a corporate strategist, problem solver, social entrepreneur, writer, mom of two, and passionate for growth, at home, in business, or in my community. This is season 1 of the Make Space for Growth podcast, Finding Growth in a Crisis. In this season, I have asked amazing women leaders to join me in a fireside chat about how they have dealt with lockdown. We will spend some time learning about their businesses and how they have coped or not with it. Lockdown, shelter in place, whatever it may have been called in your area. For me, this has been an inspiring time. I find crisis can create excellent opportunities for cleansing, decluttering, and finding new avenues. At home and in our business, crisis can make space for growth. Join me in this journey to find out how, because it is time for hope and light. For episode 4, I have got Dr. Kristina Brovig with me today. Dr. Kristina Brovig was born in Long Island, New York, and moved to Oslo, Norway at age 10. In 1993, Kristina arrived in the UK to study medicine at Ninewells Hospital and Medical School in Dundee, Scotland. She graduated in 1998. In 2003, she completed her general practice training, which was done in London hospitals, in a long list of specialties which I will try to get correctly: emergency medicine, general medicine, pediatrics, neonatology, geriatrics, nephrology, transplant surgery, vascular surgery, obstetrics and gynecology, and then in general practices in Richmond and Ham. She took further diplomas in obstetrics and gynecology, as well as family planning during this time. Kristina worked for the NHS for several years before moving on to full-time private general practice as an associate for 13 years. In 2017, she started her own practice, Brovig Health, on Sloane Street in Chelsea. She's a member of the General Medical Council, the Independent Doctors Federation, the Chelsea Clinical Society, and the Sloane Society. Last but not least, she's the mother of an almost 12-year-old boy and married to an Italian working in finance. This is bound to be a fascinating conversation. Let's dive into it. Right, Kristina, welcome to the Make Space for Growth podcast.
Thank you.
And thank you for accepting the invitation today.
Pleasure.
Before we talk business, let's start with a little icebreaker. What was your favorite thing to do as a child, and what did you want to be when you grew up?
Okay, the only thing I ever wanted to be was a doctor. I think I spent 2 months wanting to be a marine biologist, but then decided back to doctor. And I used to paint my dolls or draw red on my dolls and stuffed animals, and then I'd bandage them up. So it was really, that was it for me. I was very lucky. It was a real vocation.
That was always there.
Yeah.
So I've given people a glimpse of what you do, and being a doctor is relatively straightforward for most people. However, can you speak a bit more about your focus and the business model? Because people often forget that doctors run businesses as well.
Sure. I'm full-time in private practice, so that's also very important. One isn't employed by the state. I have a company called Brovig Health, and that's the name of the company in the practice. And it's a little bit, I guess, boutique medicine, because I have the privilege of knowing my patients very well, knowing their families very well, their, the family history. And that's very important when it comes to not only current health, but if people have a little bit more complicated things going on, and also when it comes to disease prevention. And so I have this private practice, myself as the main doctor. There's other people that help. A lot of things are external. So billing and things like that I keep separate so I can focus on the medicine. And I do everything from, I do a lot of general medicine, obs and gynae, pediatrics, and a lot of disease preventative health.
Kristina, I know you were very busy in the last few months. You're generally very busy, but I'm imagining it was a bit of a mad time, and people are certainly going to be curious to hear from a doctor in times like this. So it's some days it's news, some days it's old news, but it's always worth talking about it. So just in the early signs of COVID-19, London was still open. What were the measures that you had to take in your practice? Did you stop seeing clients? What was just the first impact while we were still at the inception of it?
I was very concerned that London was, or that the UK was late to the game. I was very lucky having a husband who is very aware of the news and charts and graphs, and he started following this very much around Christmas and saying, do you realize how this is going to go? And he's Italian, and then when things started happening in Italy, we were actually skiing in France, and there was very much panic because it was just a question of when. And I was very concerned that people were catching on late. So returned to the UK at the end of February, skiing for a week, returned to the UK end of February. The people who, I have a lot of patients who are foreign, and the foreign patients were much more concerned than my UK patients. And the first thing I did was I ensured that we had extra computers and extra telephones, and started wearing masks and started wearing gloves. Of course, just with somebody sitting and I was sitting 2 meters away from patients, and started with those precautions very early. And I think other people weren't quite as on board. The foreign patients were, but some of the UK-based crowd a little less so, maybe.
So what were the steps that followed? Certainly we go into this, somewhat feels like lockdown. People are at home. NHS is telling people not to go to hospital. What happened then? How could you provide medical care, and how did the people's attitudes change?
I had a lot of patients, and what happened is, private patients, they were turning around and saying, rightfully so, not feeling too comfortable with this, call NHS 111, good luck, and take some paracetamol. And I don't mean to be, I'm not criticizing other doctors or nurses. This was a system. This was the system that was dictating this. They were dictating we weren't allowed to swab patients, even if that had been a possibility to do so. They wanted to keep everything centralized. The way I managed it was very much one-on-one contact with patients. And in the beginning, there was a lot of FaceTime, continuously on. With time, I set up I set up video calls and video consulting. However, in the beginning, it was lots of telephone calls and lots of WhatsApp. And the way that I would do it is, and so I ended up devising a system which ended up working, and it was a bit of trial and error. If somebody was sick, I would speak with them. The difference is also, how do you differentiate between someone who's sick and somebody who's worried well? And both of them are important concerns. It's just you need to prioritize a little bit. And so I would speak with somebody, have a super good chat with them, half an hour, what was going on. We would be sure to send medicines, be sure that they have the different equipment to check themselves. And then what we started doing is, this was my little system, every 3 to 4 hours they would update me on their symptoms. And so by updating me, it was a little bit like, and then if they had a cough, they would cough into the phone and we'd be recording these things. But it was a way of keeping track of patients and picking up on the nuances. And that has been my whole concern. When you are told, and I understand it's that the system didn't have capacity, but when you are told to wait and dial 111 and take paracetamol until then, there are days that can go when you can be using preventative measures or measures that help reduce inflammation in the body or reduce a fever in the body. And all these home measures that one can take and all the advice that I can give somebody, God forbid it's really serious, they're not going to work.
And so, clearly you gave a lot of support with people that had COVID, self included. But, what about your normal patients, the ones that were seeing you for other, non-COVID related illnesses? I think it's been widely spoken about how those people got cut out of the medical system. How did you continue supporting them in this new remote medicine?
The patients that I was concerned about, particularly the ones immunosuppressed, the ones with mental health issues, psychiatric issues, particularly people with anxiety, depression, self-harming, I reached out to them directly and said, this is a challenging time. This will continue to be a challenging time. And I made a big point of trying to follow them up, of extending the branch and at least wanting to speak to them to monitor that they were okay. People who, for example, having different cancer treatments, it was very much about speaking with the specialists and how can we continue with that care in a safe environment? Because if somebody's immunosuppressed, the last thing you want to do is go out into an atmosphere where there's infection. And so it was also, how can we get some of these treatments done at home? And also, what can be delayed safely and what cannot?
Yeah, so clearly, sometimes I interview people and I ask them about some of the business practices that change. Like all of your business practices had to change at this point.
It's very much a priority. So the occasional person would be, I need my checkup. It was very strong rules that came in. One wasn't allowed to do checkups. One wasn't allowed to do routine things. And then, of course, is the whole discussion and debate about what happens with everything routine that has not happened. Luckily with my patients, we've been pretty on the ball when it comes to screening and preventative, and we're monitoring things. So if there's a delay a couple of months, it's not a problem, because we've already been many steps ahead. I wrote an email and said, don't worry, I'm on it. We'll sort it out in the autumn or after the next peak or the next wave, or whatever happens.
Yeah, well, actually, that brings me to my question. I noticed that one thing you started was this newsletter to clients addressing, some of the concerns and some of, as you say, the FAQs almost, that everyone must have been asking you and flooding you on the WhatsApp. Is this something you did before? Why did you do this? And do you think you're going to keep doing it?
It's interesting. I should be writing an update, but I think people are so COVIDed out. But I will write an update at some point. But I think it's like, oh my God, more COVID information. But we have the luxury of that here now, for example, in Europe, because things are quite good. I have patients, here it's calm. I'm communicating with patients, for example, in Brazil and in Egypt, and the States, where things are at a different point in the COVID journey. At least this first wave. I was being asked a lot of similar questions, and I think that a lot of the information people were getting was not accurate. For example, in the UK, there were no figures published for a very long time. There were figures published in other countries far earlier. And so I think people were wondering a little bit, well, what's going on and what does it mean? And so I just came with my take, and I started doing a newsletter which just summarized how worried or not worried I was, or people should be, or a little bit how we should take it. These newsletters went a little bit viral, that they ended up being posted around, which is just great that information is passed. I don't know if it's the kind of thing I will continue. I think only if there's something very prudent. I think I'm going to do an update when it comes to the test results and, the different antibody tests and the swab tests and what we're learning along the way, the different forms of immunity. I'm a little bit disappointed. The results are not as good as I was hoping. The immunity rates are not looking to be what we had hoped for. But I think it's very important to not disturb people to talk about the weather. They don't need me to tell them about what they read regularly in the paper.
But what was the reaction? Were people kind of more worried, or actually did you kind of just appease their concerns?
They were super happy. They were very, very calmed to have a good view. Well over 150 emails back after the first round, just saying thank you for putting things into perspective. And I hope you don't mind, but I've forwarded it too, which is fine, of course. It's just spreading information, so that's fine.
So now, at least for the UK patients, things are relatively more quiet. And how have you continued now to support your clients, both in your regular practice, but also, for the people that may still be developing COVID-19 and want to get tested and so on? Can we talk a little bit about the two angles of the practice?
Yes, absolutely. There's not a lot of routine happening. People, it's very interesting, they don't want to come in, and I completely support that. People are a little bit like, oh, let me just have a summer to relax. I've had enough of staying. I don't want any bad news. I don't want to have to look for my cholesterol. I just want to relax and have a chilled out summer, which I think is a very healthy thing to do, to have a bit of a break for the people who are in the situation or in the position where that can be the case. We have been testing people in London for COVID. I'm quite concerned now that things have opened. I think people get very friendly, and distancing is less so if they've had a drink or two. And now that some people are conglomerating in 300 and 350 people groups, these numbers are bound to go up. I don't know if it's going to be as severe as we've seen before, and I think the government is more on top of it, so they'll do lockdowns when required far more urgently. I'm a little concerned in the UK that they still haven't figured out whether or not people should be wearing masks. Wear a mask. What's the harm? That's a little bit my attitude. But we are still testing people. I do think numbers are going to come up. I think if people need to get investigations or something done, now is a good time because it's a calm before the next storm. But I think that when it comes to a lot of the routine screening, that's going to be coming later. I think that's just on pause.
So as you say, things are starting to go back to normal in the rest of the economy, as we are all desperate to kind of normalize things and pretend like this hasn't happened and it was just a blip, rather than a wave, or rather than a first wave, really. In medicine, it's obviously going to stay constrained for longer than everywhere else. I know you're saying right now people, don't really want to come in. I know you're doing a lot of telemedicine right now. If things are under control, how do you see, you still will need to see patients,
Definitely.
Even if you don't need to see as many as you did before in person. How do you think things can go back to normality?
I think there's going to be massive changes. If I speak to somebody on the phone and they take certain measurements and maybe some equipment that I've sent them, and we can still get very advanced blood tests done easily with great distancing, and it's an in and out job, very efficient. But if somebody has symptoms that I have a hard time diagnosing with, looking at them telemedicine or on the phone, they need to be scanned. They need a different level of checking. By the time you examine a patient, you should have a pretty good idea of an extremely good idea of what's going on. And the examination is only 5 or 10% that should confirm. And so with the telemedicine, what happens is you just skip straight to the investigations. But if you have a doctor that's very good at history taking and thorough, that should be able to be done very well, because we can still get the investigations. Where it's going to be an issue is with with screening. Because I can speak to somebody for an hour, I can understand about their family history and how they are feeling, but if I don't actually do a breast examination, that lump can get missed. And yes, we will go on and do the breast ultrasound and breast mammogram, which might have been part of their check anyway, but maybe that's not the part of a routine check of a 32-year-old. And so that's where it's very, very much in the screening where that will be required. And I think that medicine, it has to be seen as an opportunity. It's going to be very important that things are streamlined, and I'm trying to figure out, I'm spending a little time figuring out the model going forwards. I don't know that business model yet, but I think it's going to be a little bit that possibly what I'm toying with is, if I do a big screen on somebody, do I spend X amount of time with them on a super secure video link, because there's special medical video links, so it's very secure, and then say, okay, so you come in on, we decide a day, you come in, if it's Monday, you come in on Wednesday, I examine you, so we get the examination done, I take your bloods, and then we send you for this, and this test, and we do it super streamlined. So it's also limiting people's exposure, but that everything is sorted out ahead of time.
Well, one has to believe that is actually what people will want, right? They've just found out they can see a doctor without seeing a doctor.
I know, it's great. Yeah, exactly.
Obviously, people now are nervous about the waiting rooms and all that, right? Which is normal. But in a normal scenario, waiting rooms make you nervous anyway, because you don't want to be in a waiting room. So you would hope that those practices of having the investigations done remotely rather than in person, which, as you say, actually maybe you have an even longer conversation because you're not wasting commute time in between patients. All that is hopefully bringing you new ideas. We talked a bit practical, the things that you've changed and the things that you think will have to go back, right? And it's a bit of $1 million question. And you said you've been thinking about the trends. Can you talk a little bit about some of the trends that you see emerging in this sector, and how do you think this may affect the business model?
Waste is waiting times, commuting times. Yeah, very much waiting times. Waiting for different investigations to be done in different places, and you're going from one place to another place. Even though, in a way, I think that is a waste. Then at the same time, sometimes with certain investigations, you want a particular clinician to be analyzing them or investigating them. And so sometimes the lack of efficiency was actually because you were going to the best for a particular issue, and they might be spread in different places. So that would be very bespoke. And it's that always, I think I've tried to be time efficient, but the wastage will be not, hopefully not. I sometimes run late, so hopefully running a little less late on appointments.
I think you spoke a bit about the potential to kind of have all the investigations in one place and have things booked in a more efficient way. Is that something that exists already, or is that something that needs to also change?
I think it is aimed for. I don't know how efficient it always is. The aim is going to be the efficiency, and I think it's also going to be because people demand it.
Bringing back the topic of the podcast of the finding growth in a crisis, you talked about being less late, which I'm sure it's a good feeling and everyone's happier. What opportunities do you think this creates for you as a doctor?
The fact that remote consulting is going to be more acceptable is massive. That means if there's a child that's sick at home, and of course I would always say come straight in, and that's why one runs late. One runs late because there's emergencies that need to be fitted in along the way. But if I can be in a clinic and then there's a child that's unwell and one can click on a button and have a video link, and you can, of course one needs to examine but you actually can tell quite a bit seeing a child, gee, is this actually a real emergency, or is it something that I can sort out in the clinic? Is this something that they need to go to hospital? That is going to be a far more efficient triage system, I think.
That should facilitate the emergencies that you have to face. And so, Kristina, another $1 million question, but this one with the benefit of looking backwards. If knowing what you know today, would have you given yourself different advice 4 months ago?
I'm going to get to growth, but no, because it was just it was 24 hours around the clock for very many weeks. I don't think there was any other way of managing it. And I think I was very lucky having computer systems and I figured out a good way to use WhatsApp, because I was able to be very, very on top of 30 or 40 patients at a time that were ill. It's just that it was, things were coming in. And by doing the system in this way, I only had 4 patients who ended up in hospital. Okay, it depends on what your patient demographic is. But my patient demographic was such, and also by being very proactive early on, I had 4 patients that ended up in hospital. They ended up in hospital because that was the only way to get the next level of investigation. And they were all able to go home within 6 hours. I'm not saying that anybody else where the situation was different didn't do any less brilliant job. I'm just saying that it was a way of being very on top of things. And if you could pick things up early enough, you were able to kick in with treatment, hopefully preventing deterioration. It was about acting early. One of the big things that I did during this time was realizing I wasn't going to have time for self. I wasn't going to, and we'll get on to these questions, I'm sure, wasn't going to have time for self, wasn't going to have time for family as much as I wanted. And I just thought, okay, I'm going to give myself a break. I'm doing the best that I can, and I'll sort it out afterwards, everything else out afterwards. It was about getting through the acute, because people don't get sick, by 8 p.m. People get sick at 3 a.m.
Yeah.
So yeah.
So, Kristina, you've started us already. Let's get into your home a bit. As a high-performing professional and with a lot of strains on you, you also have your family. So we've spoke already about the fact that you live in London and there was a lockdown there. Can you, outside the medical part, how was lockdown for you and the family? When did that happen? And which situation did you find yourself in?
Sort of semi-lockdown, end of February, and lockdown properly in end of the second week of March. My husband is based in Milan, and he returned to London and was working at home. And then my son's school stopped, and then I stopped working. Because also, at home, and rightfully so, my husband was like, none of us are going out. None of us are, why? And you're around people that are sick. Is that the right thing? When it came, and but one had to protect that family unit in a way, and their health and safety. And my husband, who's based in Italy, he was then home. And so we had all these dinners together. We made dinner time sacred. And there was only 1 or 2 dinners where we didn't eat together the whole time. And we've never had that. We've never seen each other so much. It was amazing.
Experience. And so how did you talked about the dinners, your son who's almost 12 is probably home with this concept of homeschooling.
Yes.
Your husband's working from home. How did you manage all this?
We had a floor. This was my husband's thing. We each have a floor, and we had to be able to close the doors so that nobody could see anybody else's mess. And it was great. So each had an area. And we had somebody who was at the time living with us at home, which was very lucky. Deliveroo is my best friend. I haven't used Deliveroo now for 6 weeks, and they keep sending me emails, "We miss you," which is really worrying. But
how good of a customer you've been.
But we did have somebody at home at the time. Things started to loosen up, and we had more people coming to the house to help. I made them wear surgical scrubs and gloves and masks and goggles. So we kept everything very, very quarantined still.
You had a bit of help, which helps, and you've talked about the different floor systems, so you can close out the door. Still everyone's home. Distractions continue to exist.
And my son was homeschooling himself, basically. Okay, granted, he's almost 12, and he didn't want me sitting there over him. And he was very, very good, because he was always on time, and he did a very good job. He was practicing his trumpet. He took one of the subjects became Minecraft, and I think he excelled at that. It was interesting, because I had spoken with several clinical psychologists and teachers and things like that, and I was worried. People were questioning, and people were asking me, about, what do you think about the degree of screen time? And I think far more of a worry one needs to slacken the rules, but far more of a worry during quarantine, especially for an only child, but also for all the children, is isolation. That's far more worrying than the fact that they've got school online and that they play online. My son was playing with 8 friends at a time, and that was very social. And I thought, there's no way, either he can do that or sit there with me. And that was preferable for him, understandably.
I think that makes sense. And so, you had him being very good, but obviously, still wants some attention here and there. You had your husband, and you had multiple patients, more than you probably had before, at the same time on your WhatsApp. How did you stay productive?
Just plowed through it. There was not even time to organize. I mean, it was so busy that, of course, you brush your teeth twice a day, but it was so busy brushing one's teeth needed to be scheduled in almost. I mean, I'd be brushing my teeth with my phone on mute so I could be listening to what was happening. It was very, very busy. And I think the important point is people were very scared. And they were very scared because they didn't want to go into, those 4 patients that I had end up in hospital, which is quite extraordinary that it was so little. None of them were tested. Nobody was tested because they weren't admitted. And so people were scared. At the end of the day, I think that what we've found is even people who were swabbed, there's a certain amount of false negatives. It depends if the antigen is present in the nasal passageways in the back of the throat. That's going to be in a certain amount of time. It's missed. I have a whole group of patients where actually they didn't have the classic symptoms of high fever, cough, headache, sore throat, whatever the combination of symptoms, but at least fever and cough as the 2 main ones. But the ones that had more autonomic symptoms, they've all tested negative, and they're all testing negative for antibodies, but there's no question that they've had COVID-19. And I mean, I have patients that have had symptoms for 19 weeks now. There is a prolonged inflammatory response, and also people where they're getting flares again. So it's a very, very strong infection, and it's held its cards very close to its chest.
Kristina, one of the topics that is very close to my heart, and you started alluding to it in terms of children, is mental health. And it's something I personally sought to manage very closely through my time at home. It's been a tough time for people's mental health, whether they were living with family and kind of stuck in 4 walls with more family than they ever had, or living on their own and not being able to reach out to anyone. You mentioned you had patients as well that were, that had previous concerns. Can you share a bit of tips of how you managed yourself and how you've advised your patients to manage themselves?
I was working very much with my motto, or my motto for the past 2 years, year and a half, was something I learned from my mom, who said this to me continuously, which is, don't let the perfect be the enemy of the good. And probably being a bit of a perfectionist, that was very important to remember. So when it came to family, it was very much that we are together in a way that we have not been, and that we are able to be safe together, and that after dinner, when possible, I sometimes had to check out, but we would watch an episode of Friends together, all of us on the couch, and just my husband and I was certainly too exhausted to talk properly, but just having this family time together and this security, that was great. Exercise, it should have happened. It's not going to happen. My exercise was moving from the couch to the dining room table because that was my floor, and and since lockdown is now less strict, and so now I'm jogging, but I'm just saying that at the time it wasn't really possible. When it came to patients, I think actually something that helped some of their mental health was, I know it sounds silly maybe, but those newsletters, which were very, very real about what one should and should not be worried about, what one should or should not look out for. And also the idea that if you have symptoms, get in touch. It's not like if you have symptoms, good luck, take some paracetamol. I think that was very important for people. I think that puts fear into people. I think in the UK, a lot of the fear was they didn't have a government, this sounds horrible, I'm not meaning to be political, I'm telling you what I observed with patients, but they didn't have a lot of confidence in how things were being managed and in the guidance that they were being given. And when you don't have confidence like that in a system, then you turn around and one feels, how can I manage things as best as possible myself? And so people started clasping at straws.
Yeah, I think when you wonder who's there to take care of you, it gets a little bit anxious, I guess, in the day-to-day. So, Kristina, this was a truly challenging time. No questions on that. But if you had to pick one, what was the biggest challenge for you?
Letting go of the fear of letting someone down.
That's a big one.
which is a little bit along the line of don't let the perfect be the enemy of the good, as in just realizing that I would do the best I can, and that is, and really, really do the best I can, but that is all that you can do. And because it's a little bit difficult. Of course, when people are very sick, you do the best that you can for them. But it's also about learning and saying, okay,
I have done it.
Yeah, I've done it, and you can only handhold to a certain amount, a certain degree.
Going back to our growth perspective, you spoke about the Netflix series, you spoke about the dinner together. What other opportunities did you find in being stuck at home?
It was actually, I've had a very, very big shift, I think, because as I mentioned before, I went into this quite tired, having worked pretty hard on this for 3.5, 4 years. What this did when the urgent COVID calmed down, Guido and I were on a drive, and he started talking about when our son would be 18 and go off to university, and where would we live and what would we be doing. And I became so depressed and sad. And then we went on a drive the next Sunday, and I again felt the same way. And I thought, I don't want to think about what happens when he's 18. I want to think about the next 6 years and how I'm going to spend them with him. And so what happened for me, it's been very much the concept of time, and all the things that I was waiting to be able to implement, I've turned around and thought, actually, they are now the priority. Taking care of oneself is you're not going to get time back. You're not going to get health back. And one needs to prioritize those things in a slightly different way. It doesn't mean caring for patients any less or one's business any less, but it's a little bit, I didn't have time to exercise, or I don't want to say brush my teeth, because I did brush my teeth, but all those things one doesn't have time for during a crisis. One turns around and says, actually, they're not a choice, and this time is very precious.
That's great. Thank you for sharing that. I want to end this on a light note, and these are the secret questions that I didn't tell you about. I know you've heard the podcast before, so you have a head start on it.
Yes.
So 5 short questions for whatever comes to mind first. What was your lockdown book?
Get Out of My Life, but First Take Me and Alex Into Town. And it's a parent's guide to the new teenager. That's good.
That's appropriate. And lockdown sport?
When it was a little less acute, I started then my lovely jogging. Very nice, very special.
Lockdown technology?
WhatsApp and video consulting.
And what was lockdown greatest lesson?
Do it now.
If you had one word to describe lockdown, what would that be?
Can I say 2? First, exhausting, then enlightening.
I guess that's fair. Kristina, thank you so much for joining us on the podcast and for sharing so many insightful moments, into what was the most strained sector that we had. And I really appreciate you being with us today.
Absolute pleasure. Thank you so much. And thank you for putting this together, Sarah. It's really great what you're doing. Thank you.
I hope you enjoyed our conversation today. I have loved learning about the other side of a doctor's life. It is easy to forget doctors run businesses, run homes, and they also need to take care of themselves. What did you think? This is our very first season, so your support would be great. Please rate us and leave us a review on your favorite podcast app. Do that now. You can read more at makespaceforgrowth.com and join our community to access our free Facebook group. Please share your thoughts and questions on Twitter, Facebook, Instagram. I will add all the links to the show notes. It has been a pleasure to bring this fireside chat to you today. I am grateful that you are there. I get to do this.